was formerly known as Allahabad. Presently, I am working in the capacity as Professor of Medicine, Motilal Nehru Medical College, Prayagraj. I would like to talk about COVID situations. As we have experienced, last 2 years has been a living nightmare for all the people around the globe. And our being a tertiary care center, we have catered to many number of patients. We have seen lots of people losing their life because of COVID. So there has been various diagnostic and current guidelines which Government of India also have approved for combating these illnesses during the COVID times. So as we move ahead, the dread seems to fall down, but we should not leave the caution to the air. The virus, as we know, the coronavirus is a duplicable virus which has a tendency to mutate and change, and we have seen the variants coming around frequently over the time, and this may keep on going till the pandemic goes. The last pandemic, which was 100 years back, has given us a lesson that it may come in waves, and it requires more than the medical efforts to combat this pandemic. Not only we need to follow the current guidelines, every country has a recommendation guidelines. Because of the change in the virus, there is no definitive treatment that this may work or this may not. The preventive measures still remains the mainstay of the treatment. So my message to everyone is, get yourself vaccinated. Whatever vaccine you want, you can, they all are efficacious, which has been approved by the Government of India. So do vaccinate now. The adolescents, the adults more than 18 years, for both the doses as well as the precautionary doses is available, and following the protocol, following the measures may also seem to be a better option once you are in public. Follow SMS, sanitization, mask and social distancing. A word of caution for the diabetes patient or the immunocompromised patient, this is the experience which we have, this is the lots of data which we have published during the past 2 years. Diabetes has been one of the major risk factors, obesity yet another major risk factors which the patient succumbed due to COVID-19. So it is not that these are the individuals who may get infection, but they are the population who are vulnerable, who are immunodeficient. So these are the ones, they should be vaccinated more adequately. These are the ones who needs to take care of their blood glucose and weight regulation more religiously, so as to prevent not only the coronavirus infection but any other infections which may come over the time. So it's our duty to educate every individual for getting vaccination and following the protocol. So because all around the globe you may keep on hearing, today the cases have increased here, you are again a resurgence there. So this may keep on going for a period of time, but still following the measures, following the protocols may be a road ahead. Thank you.